Mechanical principles of extraction are: first one, expansion of bony socket to permit removal of its contained tooth. This is achieved by using tooth as the dilating instrument and is the most important factor in forceps extraction. So, if this is the tooth which is to be removed, this is the bony socket, this is the bone, this is the bony socket. So, the tooth is used as a dilating instrument. So we will hold the tooth with the help of forceps and we will try to dilate the socket by using the tooth as a dilating instrument. So what will it facilitate? It will facilitate the removal of the tooth from the socket. Analog to this principle is the post is an example of a post embedded in the ground. If this is the ground and this is the post which is embedded in the ground, and we need to remove this post, what will we do? We will try to dilate this post. We will move this post laterally until the earth surrounding it is displaced sufficiently for its easy removal. So this is the analog. So tooth is removed in the similar way. Like the post which was embedded in the ground, we dilated the ground by using the post as a dilating instrument. Similarly, the tooth is luxated in the similar way, keeping the instrument between the PDL and alveolar bone. This is the tooth, this is the alveolar bone, this is the periodontal ligament space. We will keep the instrument here between the PDL and the alveolar bone, parallel to the long axis of the tooth with the direction of the force apical. We will apply the force in the apical direction and we will keep the instrument between the PDL and this is the bone, this is the PDL space. We will keep the instrument between the bone and the PDL space parallel to the long axis of the tooth, and we will apply the force. The first direction of the force is always apical, remember. So the socket can be dilated only if the bone of which it is composed is sufficiently elastic. So when will the socket dilate? If the bone is elastic. So remember, in children the bone is the most elastic, and with age the elasticity of the bone decreases. If the root pattern or consistency of the investing bone is such that the dilation of socket is impracticable, then the transalveolar extraction with or without the division of roots of the multi-rooted tooth must be employed. This means that if the root pattern, if there is not sufficient structure of the tooth which can be grasped by the forceps for the expansion of the socket, then, or if the consistency of the investing bone, that is, if the bone is not sufficiently elastic, which because the elasticity will decrease with age, then the dilation of the socket is not possible. In such conditions, transalveolar extraction is to be carried out. So, in most cases, dilation of the socket is accompanied by the multiple small fractures of the buccal plate and interradicular septa. These bony fragments usually retain their periosteal attachment and should be replaced by digital compression at the completion of the extraction. That is, see, when we have dilated the socket, small fragments of the buccal plate or the interradicular bone may be fractured out of the socket, which have retained their periosteal attachment. When the tooth is finally extracted, these fragments are present in the socket, and these fragments should be removed by digital compression. And if we do not remove these fragments, they will eventually die, and that can be a predisposing cause for post-extraction hemorrhage and delayed healing. Why they'll die? Because of the impaired blood supply. So the second principle is the lever and fulcrum principle. The use of lever and fulcrum is to force the tooth out of the socket along the path of least resistance. The tooth is to be removed along the path of least resistance. Sorry. This is the basic factor governing the use of elevators to extract the tooth. The first principle, that is expansion of bony socket, it was applicable to the forceps, while this one is applicable to the elevators. There are three types of levers. The first order lever is used in Exodontia and it has the most mechanical advantage. In first order lever, the fulcrum is present in between the resistance and the effort arm. So in Exodontia, resistance is the tooth, fulcrum is the interradicular bone, and effort is the handle of the elevator. So remember that interradicular bone should be made the fulcrum and not the adjacent tooth. Why? Because if we use, see, this is the interradicular bone. This one has to be used as the fulcrum. That is, we have to derive the support from the interradicular bone and not from the adjacent tooth, because if we use the adjacent tooth, it will loosen. Okay, but we have seen the exception in the Stobbe's extraction. We use the adjacent tooth as the fulcrum. Now you have to remember that the length of the loading arm, greater the length of the loading arm, more will be the pressure applied by the load arm. That is, if this is the effort or load, this is the fulcrum and this is the resistance. So the distance between load, effort and the fulcrum is the length of this loading arm. Greater this length, greater will be the force, pressure applied by this arm on the tooth. Therefore, for easy removal, since more pressure will be applied, therefore it will be removed easily. Therefore, for easy removal, the fulcrum should be as close to the tooth as possible. Our resistance, we saw that resistance is the tooth. So fulcrum should be as close to the tooth as possible for easy removal. The next principle is the wedge principle. To create an inclined plane from which proper support can be taken, insertion of the tip of wedge parallel between the root and the bony socket causes the tooth to rise in its socket, severing the periodontal attachment. That is, the tip of the wedge, that is the elevator, we insert it in between the root and the socket, which creates an inclined plane for the tooth, and the tooth will rise in the socket, severing the periodontal attachment. We know that the tooth is attached to the bony socket with the help of periodontal fibers. So when it rises in the socket, the periodontal attachment is severed. So the tooth will eventually rise in the socket. This is the wedge principle. So this principle is used in conjunction with the lever principle, and the inclined plane can be created with the help of forceps and as well as elevators. The next principle is the wheel and axle principle. It is the modification of lever principle. In this, the force or effort is applied to the handle. If this is an elevator, this is the handle, this is the blade. So the force is applied to the handle. We apply force here, and its action is generated at the tip. Okay, the force is applied to the handle, and action is generated at the tip. This principle is used in crossbar elevators. Crossbar elevators look something like this. Okay. So we apply the force to the handle and the action will be generated at the tip. And criers, we know window crier elevators. So force is applied to the handle and the action is generated at the tip. So crossbar elevators, their mechanical advantage is more than 3 times, and crier elevators, their mechanical advantage is 3 times, 3x. So working point of the crossbar is engaged deep in the space between the tooth root and the bone. This is the root which is still in place, and this is the bone. We will engage the working point of the crossbar, and then we will rotate the handle and the root will be removed, because the force is applied to the handle and its action is generated at the tip. Since we have engaged the tip and in the space between the tooth root and the bone, and then we have rotated the handle, the force, we have applied the force to the handle, that its action will be generated at the tip and the root will be removed. Some important points to remember. First application of the force is always in the apical direction. That is, when you attempt to extract the tooth, the first direction of the force should be in the apical direction. This is the apical direction towards the root apex. Second, avoid excessive apical pressure on maxillary molars. Why? Because of the vicinity of its root to the maxillary sinus. Therefore, we have to avoid excessive apical pressure while extracting the maxillary molars. Third, ideal location of the beaks of the forceps is at or below CEJ. So when we hold the tooth with the help of forceps, the beak should be at or below CEJ, because we know enamel is brittle and we apply the force. Therefore, we place the beaks of the forceps on the root, that is on the cementum, which is not as brittle as enamel. Then, buccal cortical plate is thin than the lingual cortical plate in mandible as well as maxilla. Exception for this is in the mandible, in the molar region. Mandible in the molar region, the buccal cortical plate is thicker than the lingual cortical plate because of the presence of the external oblique ridge. Remember, buccal cortical plate is thin than the lingual cortical plate in maxilla as well as mandible. But in the mandibular posterior region, in the molar region of the mandible, the buccal cortical plate is thicker than the lingual because of the presence of external oblique ridge. Obviously, it will make the buccal cortical plate thicker. Then the path of extraction, it should be along the path of the least resistance. We already studied that the path of the extraction or the path of the drainage of the infection, it is along the path of the least resistance. Therefore, the path of extraction, it will be buccal because buccal cortical plate is thin and occlusally. Then tooth should be first moved and then removed. We do not have to just hold the forceps and remove the tooth. We have to first move the tooth, that is, we have to dilate the socket, and then force applied should be slow and deliberate and not a jerking force. When we apply the force, we do not have to apply the jerking force. The force should be slow and deliberate. And rotary movement is used for delivering the conically rooted teeth out of the socket. For example, in maxillary central incisors and mandibular second premolars, we use the rotary movement. Now coming on to the delivery of various teeth, first comes maxillary incisors. We apical placement of the forceps and apical pressure. We have placed the forceps beaks below the CEJ and then applied the apical pressure. Then we will apply a labial movement for a few seconds, then lingual movement, and then rotary movement because its roots are conical. So rotary movement will facilitate the popping of the tooth out of the socket. Then upper maxillary canines. These are, in this the movement is similar to the incisors, but canines have long roots and often canine eminence is adherent to the root, making it more difficult to extract. Therefore, these often require mucoperiosteal flap elevation, that is surgical extraction. Coming on to the maxillary first premolars, we know these teeth have two roots. So the force application will be first apical, then labial, and then lingual, and no rotary movement because bifurcated roots can be easily cracked at the apical third, especially when the rotary force is applied. Therefore, rotary forces are contraindicated for multi-rooted teeth, which is confirmed by the panoramic radiograph. Maxillary molars. These are more difficult to extract because of more pedial volume holding the root. We know these teeth have three roots. Therefore, there will be more pedial volume holding the tooth with the bone. In these, in maxillary molars, buccal movement is applied, then palatal movement. And in these, we favor buccal pressure for removal because palatal roots may be forced into the sinus if excessive palatal or apical pressure is applied. As we already saw in the important points, in the maxillary molars, excessive apical pressure should be avoided. So if this is the maxillary molar and these are the forceps, we will apply slight apical pressure, then buccal, then lingual, and then we will deliver the tooth in the buccal direction. Then lower incisors and canines. In these, bone is thin on both sides of the teeth. We use less rotation because they have less conical and less circular roots, and we prefer more buccolingual movement in the lower anteriors. Lower premolars, these are the easiest to extract. Rotation is important because these have single rooted teeth and they are conical. Now, lower premolars, these are the hardest to extract since roots are divergent and density of the bone in the posterior mandible is the greatest. Direction of the force, apical, buccal, and lingual. In case of grossly decayed teeth, cow horn forceps are used, which engage the bifurcation. This was all for the topic Exodontia. Hope you liked it.